Yes.
Okay, go.
Okay. This is Matthew. Matthew is my new med student. I know you guys were asking for a new med student to come. I only have one every 6 weeks, and this is his turn. So Matthew's saying that he has some neck pain, and you were saying you were having some muscle spasms. So tell me a little bit about it.
Well, it started a few years ago. I just noticed that I was having pain in just both sides of my neck, kind of going down my shoulders, just tensing my back, tensing my neck.
Okay. And then what is your history? Where do you think that came from?
I got hurt when I was in the military, and ended up with some just vertebral issues and some muscle spasms since then.
And now you're studying all the time, so obviously that makes it worse because you're straining your neck and your back and everything. So I'm gonna have you turn this way for me. And so, well, I start by just looking at the patient. And so, like, his head is even a little bit kind of tilted to the left here. It's not really looking straight. And so I then move down and look at his shoulder heights. This shoulder here on the left is a tiny bit higher than the one here on the right. And then I kind of just come and look down, and I look at his feet. His feet kind of look pointed outward a little bit. Usually people stand with their feet forward. So sometimes that can be an indication that something's going on with his hip. So I'm gonna feel along the vertebra here. And I can feel some issues here in his, it's actually on his right. So you said your left side?
My left side, but my right side as well.
Okay. Okay, and I'm gonna do what's called the standing flexion here, where I'm at his PSIS on his back here. Go ahead and bend forward, looking for hip issues. A little bit here on the right. Go ahead and stand up for me. I'm gonna start you on your back. And most of the time you guys see me start up at the hips, but it really doesn't make much of a difference where I start at. And so, Chelsea, come over here. I want you to get a screenshot kind of going down and looking. So if you can see his right foot completely out, his left foot is not like that. So that kind of gives me another indication that something's going on with the hips. So we're gonna feel at his first rib here, and I can feel this left one is higher. Bring your arm up. And then go ahead and push your elbow against me. And relax. And then go ahead and push it down. And relax. And then push one more time. So, and relax. So this is a good thing for students to actually be practiced on these for me, because they can feel how hard I'm actually pushing and what my pressure is compared to what they do. Because a lot of the times my med students don't have enough of a good pressure. So we're gonna check his rotation of his neck. So definitely restricted going to the right. We're gonna check side bending here and side bending here. So I'm definitely seeing restrictions on his right compared to his left. So now I'm just gonna go feel all these vertebrae, and I'm feeling an issue kind of at C3 right here. So definitely restricted going to the right. We're gonna check side bending here and side bending here. So I'm definitely seeing restrictions on his right compared to his left. So now I'm just gonna go feel all these vertebrae, and I'm feeling an issue kind of at C3 right here. So what I'm gonna do, try and relax your head for me. So I have my thumb at C3, and so I'm gonna put him into a position that he does not like. So I'm gonna turn into where his restriction was, which was side bending and rotation to his right. And now I'm gonna have you push to your left for me, and relax, and then push again, and relax. And then go ahead and turn to your left. Good. And that's better. That moves a lot better. So I'm just gonna go through and kind of feel again. So what's interesting is his left foot is now a little bit further out like his right foot is. So a lot of the times when people have issues and pain, sometimes it can be a lot higher up than they think it is. They can think, oh, I have a problem with my back or my hips, but sometimes it can be from up in their neck. So now we're gonna move down and we're gonna check at your hips. Move your neck around and see how that feels.
Oh, it's a lot
Better?
Yeah.
Good. So we're gonna come along to the ASIS here, these two bones, and we're gonna try and rotate them a little bit. And so he had a problem on his right side. And so I'm looking here, and this one is a little bit more superior. Bring your feet together. Okay. So he's much taller than me, so we'll see how this works. I'm gonna bend your leg here. And so I'm gonna bring his leg out, drop his leg down, and I'm gonna have to push his knee up. So go ahead and push up for me. And relax. And then push up again. Good. And and stop. One more time. Up. That's better. And now I can feel, and his hips are rotating more evenly. So, and if you look at his feet now his feet both look even. We'll go around your stomach for me. And then you said sometimes you feel it in your low back?
I do, yes.
Okay. So we're just gonna go through and feel, see, popping like a glow stick, and I'm not even trying. So his low back actually feels good. It's in his mid back here that I'm feeling a lot of tension in these paraspinal muscles. So I'm just gonna start with doing a little bit of myofascial release. So I'm just pushing straight down into that muscle belly, pushing down with a little bit of lateral traction towards me. Good. Turn on your side towards me. So I'm going to check rotation here. So we're going to bring this leg forward and twist it. So I'm more towards checking the rotation going from his upper back than his lower back. It's actually not too bad. Go ahead and sit up. Okay. So fixing lumbar segments, I usually do with people laying on their side or their back. Thoracic segments, it's a lot harder to do that, so I have them sit up. So go ahead and extend your back for me. That's flexing. There we go. And then go ahead and then bend forward. So it actually gets a little worse going this way. Okay, so come back to neutral. And turn a little bit this way. And then I want you to take your right shoulder and push it to your left. Good. And relax. And I'm gonna push you a little more. So I'm putting him more into what he does not like. So this is more of a direct approach. So go ahead and turn to your left again. And stop. Bend forward a little more. One more time. Good. And then we're going to return to neutral. And we're going to refill. That feels a lot better. Go ahead and stand up and see how that feels.
Oh, that feels a lot better.
Good. All right. All done, Chelsea.
Are you sure?
Yes, I'm sure.
Okay.